Everything from help in hospitals, hospice, to helping with housekeeping or exercise, our next guest offers just about everything you can think of when it comes to helping take care of your loved one.
The CEO and founder, Alice Milton with Patient Care Advocates, is joining us now live to explain this morning. And I love this because it is so personal what you do. It gives you peace of mind, I think, to every family member out there, because they know that they already have somebody who's specifically dedicated to the person that they love. That's what you do, right?
Absolutely, yes, and thank you for noticing that. The thing that I love most about this company is exactly that, and we get up every single day and we get to go to work committed to doing the right thing, because those are the right things. And I'm so excited about that. It's part of our corporate culture, it's part of what we teach employees, it's the reason we hire people. Get up every day, go to work to do the right thing. Because when you do that, you make great decisions. You rarely make a bad decision. You deliver perfect services, and you have happy clients, you have happy employees, you have happy people that you work with, because that means we all treat each other well, and we always do the right thing. We always look for the right answer. That's right. So that's the most important thing that we get to do every day. I feel really blessed that we get to do that as a part of our life. It means when you go to bed at night, you can sleep really well.
Yes, absolutely. Well, we're lucky that you do that.
Definitely. Having that culture, having that philosophy is what, like you say, drives all of your actions, all of your intentions, and people benefit from that. They live better lives because of that. So you're talking about what you do now. How do you do it?
Well, we do home health, which means that we offer nursing, physical therapy, social work, occupational therapy, speech therapy, and caregiving. We also do that for veterans. We have a contract with the Veterans Administration for that. It's wonderful because we really make a difference in those vets' lives. We do hospital advocacy, and we were actually founded as a hospital advocacy company. And we do home health. We do private caregiving. We also do all of those things privately, because all of those things can impact various lives in various ways. So, for example, you don't really need to go to the hospital very often. You can hire a nurse or a physical therapist or a caregiver to help you in the home a little bit of time, and it's going to turn out to be cheaper than the cost of your copay if you were in the hospital. Plus, you don't get exposed to the diseases in the hospital. You don't get exposed to some of the very callous treatment that we go through in our hospitals today. So,
which is the #1 fear, I would think, for families.
It truly is. Unfortunately, the stark reality is that medical care in this country today, even though we have the most expensive system in the world, is the 3rd leading cause of death. And it's the 1st leading cause of death if you factor in drug errors and drug difficulties. So we can do a lot to prevent that with hospital advocacy, with caregivers in the hospital, or from never letting you get there.
Preventative care.
So you're not exposed to MRSA, you're not exposed to C. diff, you're not exposed to falls in the hospital, all of those things.
And your immune system at that age is already down, so you're more susceptible to it, I would imagine.
That's precisely
So are you dedicating a specific person to the individual, or do they rotate?
When we go into the hospital with you, you typically have a nurse that you've already met. We have sent somebody to your home to do a free nursing assessment, so we know you, we know your medications. So there's not an error in that regard when we meet you at the hospital, when you actually go. So it's great. So that nurse, you typically will know, she knows you. So we know, oh, Mrs. Smith looks like she's presenting with dementia, but she's not. It's probably a UTI. Let's look at that. But again, it goes back to that, let's make the right decision. So we want to have people be consistent, but also that whole philosophy of always being committed to do the right thing really comes out in those situations. We have nurses who make tough decisions to take somebody out of the hospital because the care is substandard or they don't have the right equipment. And so we've actually pulled people out and taken them someplace else to find that, yes, we were right. We felt they had a brain bleed, so we did the difficult thing. We removed them from that particular hospital.
And a lot of this is made possible because it's locally owned. Talk about the importance of that versus the chains that are here.
That is a huge and important difference. We can instantly respond to any situation, whether it's with a client or with an employee, whereas a chain, most of them are going to have to go to New York or New Jersey or someplace else to get authority. That can take months. And another great thing about shopping locally is this. Besides the fact that we know our community and we know how people here think and feel and want to be treated, and that's crucial, but it is also, if you love your community, and we do, and we're proud to be here, then you give back to your community by shopping locally, because this, according to the City Fathers, 10% of your dollars that are spent locally create 1,600 jobs and put
Wow.
$30 million into our economy.
Just the patience emanating this direction.
Oh, I know.
Isn't it just amazing?
Right.
Such a pleasure to meet you, Alice. Thanks so much for coming on. I'm going to give them more information so they can get in touch with you.
Thank you so very much. It was a great pleasure to meet you.
Now, if you're interested or know someone that would like to learn more about patient care advocates, visit pcatucson.com or call 520-546-4141.